The knee and hip are the most stressed joints in the body. Their bony structure, surrounding muscles and ligaments, restrict excess movement at the joint and provide stability. At the points where bone meets bone, layers of cartilage reduce friction and act as shock absorbers. Any reduction in the normal function at the joint can have an adverse effect on activities of daily living, such as getting dressed, walking, and bending. The most common reason for someone requiring knee or hip replacement is osteoarthritis. This condition affects the structure of the cartilage and typically presents with painful, possibly inflamed joints with a reduced range of motion. Recovery and rehabilitation begin a couple of hours after you return to the ward, once the effects of anaesthetic have worn off. Therapy staff will instruct you in safely standing and walking with a walking aid such as Zimmer frame, crutches, or walking sticks, and also how to perform specific exercises. You can expect to be on the ward from 0 to 2 days. In a total hip replacement, the cartilage of the ball and socket joint is replaced along with the top of the thigh bone and a section of the pelvis. The implanted hip joint is made up of 3 distinct parts. The stem secures the implant in the thigh bone. The femoral head is the new ball of the joint, and the acetabular component is the new socket. There may be restrictions on how much and in which directions you're allowed to move your new hip joint, and you will be informed of these during your recovery. Each component is measured to the individual to ensure the best fit, maximum stability, and ensure the smoothest function. Similar to hip replacement, knee replacement surgery begins with removal and shaping of bone in order to fit the prosthesis. Precisely measured components are fitted to the bottom of the thigh bone, top of the shin bone, and underside of kneecap. Once in place, these individual pieces will make up a new, secure, and low-friction knee joint. The prosthesis is made from a hard-wearing, long-lasting alloy to ensure joint function continues for many years. The new joint is tested to full range of movement in the operating theatre. An X-ray is used to confirm integrity and position the day after surgery. Early and regular mobilization is essential for optimal recovery following joint replacement. Therapy staff will aim for a consistent progression in mobilizing in terms of distance and walking aid required. Exercises and mobilizing need to be continued and progressed once at home for best results. Hip and knee replacements are major surgeries that are particularly traumatic for the muscles and soft tissue surrounding the joint. The result of this trauma will be a significant amount of pain. This will be masked by anaesthetic immediately after surgery, but will become more apparent in the hours following. You will have access to regular pain relief and optional extra pain relief. Ask for pain relief when you require it. Nursing staff will only give you as much as you are allowed. If you are able to begin your exercises before your surgery, you can speed up your recovery. The exercises focus on the fundamental movements of the joint, and the strength of the muscles they target will ultimately determine your ability to walk, sit, stand, and perform all the movements necessary to move about your house and out in the street. The major muscle groups controlling hip and knee movement are the 4 at the front of the thigh, 3 at the back of the thigh, and the 3 that make up the bottom. For the knee, there are specific targets set for strength and range of movement, namely, being able to fully straighten the leg and lift it in that straight position, and bending the knee to 90 degrees. Activation or waking up of the thigh muscles will be necessary before straightening and or lifting the leg is possible, and bending the knee will be initially painful, and you are unlikely to be able to achieve 90 degrees bend at first. There are no set targets for the hip exercises, rather you should progress towards equal strength and range of movement on both operated and non-operated sides. The operated hip should ultimately feel equally secure whether it is the working or supporting leg. Once you can transfer and mobilize independently with a walking aid, handle stairs if necessary, and complete your exercises, you can be discharged from therapies and are ready to go home. At home, you need to continue and progress your exercises as advised by the therapy team. Ultimately, the outcome of your surgery is dependent on you. We are here to help, and there will be either a telephone or face-to-face follow-up scheduled to see how you are getting on. You can contact us at any point by telephone or email if you have any questions or need any advice.